Just det, och
Nu
när...
är det Sveriges tur att
Warm
prata.
welcome from Oslo and Umeå to this Barents meeting on e-health. We are here to discuss how new digital solutions can give better healthcare in the Barents region. Norway and Västerbotten are proud to present an interesting program and a great list of speakers. We will be hearing from politicians, experts, and entrepreneurs. It's a pleasure for me to introduce State Secretary from the Norwegian Ministry of Foreign Affairs, representing the Norwegian chairmanship of the Barents Euro-Arctic Council. Please, State Secretary Audun Halvorsen, the floor is now yours.
Thank you so much, Geril. Excellencies, ladies and gentlemen, friends of the Barents region. It is a great pleasure to welcome you all to this meeting. When Norway organized the first ever Barents Health Ministerial Meeting in November last year, we expressed our ambition to follow up with an expert meeting to discuss digital tools for better healthcare. We are very pleased to see politicians and experts gathered here for the discussions we are hosting today, together with our close partner, Västerbotten, the chair of the Regional Council. As chairs, our task is to continue to strengthen cooperation between the national and regional levels. The Joint Working Group on Health and Social Issues includes both national and regional participants. It is an excellent example of the unique dynamic between the two levels and illustrates Barents cooperation at its best. I would like to thank the chairs of this group, Sweden and the region of Karelia, for their hard work and for joining us today at the political level, also in these demanding times. Norway chose health as one of our chairmanship priorities because this is an issue that concerns all of us. The health and well-being of the individual is also a very important dimension in ensuring dynamic and resilient Barents societies. Of course, when planning for our chairmanship, we had no idea that international health cooperation and modern solutions would assume such a pivotal place on the international agenda. The COVID-19 pandemic has demonstrated the need for dialogue and exchange across borders in the north all too clearly. Societies in the Barents region are vulnerable, as many of our Arctic societies are remote, which has been underscored by the closing of borders due to the pandemic. Our young people have expressed concern regarding feelings of isolation and mental health problems, issues that seem to have grown worse during these past months. At the same time, however, we have seen just how strong our cooperation truly is. We are fortunate to be building on friendship and ties that extend back nearly 3 decades. At the digital high-level meeting on the 26th of October, we all witnessed the strong commitment exhibited by the members of the Barents Euro-Arctic Council. As chair, Norway is determined to keep up the political momentum and to make sure we move forward with energy and with purpose. We will continue to work to expand the potential and the opportunities the Barents region has to offer. People-to-people contact is the backbone of our cooperation, and we look forward to the day when cross-border activities can resume. We are confident that the new financial mechanism will give greater substance to Barents cooperation and provide much-needed support to the working groups. We hope to be able to launch a Barents financial mechanism by the end of our chairmanship. And let me take this opportunity to thank Russia, Sweden, and Finland for their support and valuable input in this process. Hopefully, once it has been established, this mechanism will also promote even stronger cooperation on health. Knowledge is another priority of the Norwegian chairmanship. Education, research, and competence are vital components of the health sector. Our medical experts have been working together for many years, and Barents Health Cooperation is a success story. We must also be able to work across sectors. Innovation and new technology will play an important part in solving the health and social challenges that we face today in the Barents region. For the Norwegian government, the input of young people has been a valuable added dimension to our work in the Barents Cooperation and in our Arctic policies in general. We appointed a youth panel to provide input to our newly published white paper on the Arctic. As chair of the Barents Euro-Arctic Council, we cooperate closely with the Barents Regional Youth Council, and this has been an inspiration to us. Many of the most forward-looking visions for the Arctic region come from our young people. Therefore, I'm very pleased that we will be hearing from ambitious young entrepreneurs at today's meeting. And we are proud to have Maria Alén from Lifeness on the program. Maria's company has provided a digital solution that can promote better health for many through lifestyle changes. And this is what real entrepreneurship is about. Last week, Lifeness was awarded the Social Entrepreneur of the Year prize by Prime Minister Erna Solberg. Health is a topic of great importance to all of us. And to find the best solutions, politicians, experts, and businesses need to join forces and discuss how to proceed. We need political leadership, we need knowledge, and we need innovation. And all of this is the focus of today's expert meeting on e-health. So, on behalf of the Norwegian Ministry of Foreign Affairs, it is again my honor to welcome you and to kick off today's discussions. Thank you.
Thank you, State Secretary Halvorsen. As the State Secretary underlined, it is important to Norway as chair of the Barents Euro-Arctic Council to cooperate closely with the regional level. Like our high-level meeting on the 26th of October this year, this is a joint national and regional event. It's a great pleasure for me to introduce our friend and co-host, Governor of Västerbotten and Chair of the Barents Regional Council, Helene Hellmark Knutsson. Please, Governor, over to you.
Thank you, Geril, and thank you, State Secretary Halvorsen. Dear State Secretaries and Barents friends, it is a pleasure for me to be here with you today. And if there is one topic that is fitted for an online seminar, it is e-health. Healthcare practice by using digital tools and sharing information digitally to achieve and maintain a good level of health. The COVID-19 situation has forced us to meet in this way today, but it also has meant that e-health is more relevant than ever. In a situation where we should try to avoid physical contact as much as possible, e-health technologies are accelerating. This is something that we will get to know more about today. When Västerbotten started to draft our Barents Regional Council Chairmanship program almost 2 years ago, no one could foresee the development that we are facing today. E-health is one of the topics that we are focusing on in our chairmanship program, and what a relevant topic that turned out to be. E-health can be used to bridge the distance in remote and rural areas and a tool to meet demographical and economical challenges. The Barents area share the same challenges when it comes to sparse population, aging population, and long distances. Therefore, e-health is a highly relevant topic from Nordland in the west to Komi in the east. In Västerbotten, e-health has been developed for many years. Later in the program, you will get to know more about the work of making healthcare more accessible in remote and rural areas in Västerbotten. Västerbotten is working very closely with Norway as the national chair, and together we are hosting today's seminar. And like State Secretary Halvorsen said, that the dynamics between the regional and the national levels are what makes the Barents cooperation unique. And this is something that I really can underline. To conclude, healthcare costs are estimated to increase the coming years. However, digitalization and new technologies available in the field of e-health presents new healthcare opportunities. Today, I look forward to listening to interesting interventions about these opportunities. Thank you.
Thank you very much, Governor Hellmark Knutsson. This meeting is organized in close cooperation with the Joint Working Group on Health and Related Social Issues. Sweden is now chair of this working group, and we're very lucky to have with us today State Secretary for Health and Social Affairs of Sweden, Maja Fjestad. Please, State Secretary, the floor is yours.
Thank you so much. I will start with maybe the most common phrase in 2020. Do you hear me? Yes, good. Thank you so much, Norway and Västerbotten, for organizing this conference. And thank you so much, Helena and Auden, for these very interesting comments. As a state secretary with responsibility for health during a pandemic, of course, much of the energy has been directed to crisis management, but it often surprises me how much of the response to the pandemic that has to do with digitalization of health and e-health. And the digitalization of health has really been in focus during these very intense 10 months. The Barents region faced specific challenges in providing high quality and comprehensive healthcare services. To plan for, organize and deliver healthcare in remote and sparsely populated communities pose severe challenges. E-health is indeed of highest importance and relevance for the challenges we face in the Barents region. As you will hear later this morning, there's interesting and exciting work going on in our region at the Center for Rural Medicine in Västerbotten. In Sweden, we have worked to increase the use of digital tools in the healthcare sector for many years. We have a vision that states by 2025, Sweden will be the best in the world at using opportunities offered by digitalization and e-health to make it easier for people to achieve good and equal health and welfare. And I must admit, it's not a very humble vision, but I like it that we take a stand for e-health and we take a stand for actually the opportunities offered by e-health rather than digitalization itself. Our healthcare sector has been quick to adapt and incorporate digital tools. Since a couple of years, we have almost 100% coverage of e-prescriptions, and our healthcare providers are using digital health records since at least 10 years. The usage of e-health services increased steadily, and 7 out of 10 people have an account on the National Health website. But, dear colleagues of the Barents, we are not and should not be satisfied. There is so much more we can do with the help of modern technology. This conference is an excellent initiative, and the topics of the discussion today are of high relevance for the future of healthcare. The pandemic, well, it's really affected the healthcare sector in many different ways, and I think that we will realize how much effect it's had on healthcare in many years coming up. But in Sweden, we have had for several years substantial efforts to introduce the possibility of choose digital visits, both in primary healthcare and hospitals. And during the pandemic, we have seen a sharp increase in the usages of these services. In Stockholm, for example, there's been an increase in digital healthcare visits by 1,000% during the spring 2020. And I think that we must be open and see what opportunities digitalization offers when it comes to combating communicable diseases like COVID-19. We're seeing many different tools and ideas being tested and implemented, and we welcome a continuous follow-up on these efforts so that we can learn what works and agree on the best practices for the future. Because we must also safeguard this development. What can we do to keep the development coming? And I think that we must also discuss what has not happened during the pandemic, what innovations has not been invested in, and which innovative projects has disappeared during the pandemic in the regions. So there's call for optimism in digital health, but there's also a call, I think, to sit down and realize what did not happen during the pandemic. So let's take advantages of these new technologies made possible with digitalization, and we need also to deal with the challenges we see in our region. I'm very satisfied with the priorities on the working group of health, currently chaired by the Russian Republic of Karelia and Sweden, on new technology and methods in healthcare to develop and stimulate regional initiatives for improved healthcare systems. This work is indeed of highest importance and relevance in the Barents region. Dear colleagues of the Barents cooperation has been a cornerstone of regional cooperation since 1993 and is a high priority for Sweden. We look forward to a continued cooperation, especially on healthcare services and good welfare. I wish you good luck with the rest of the conference today, and I hope we meet soon again to discuss the important topics of e-health, maybe physically next time or maybe digitally. And I would also like to take the opportunity to wish you a Merry Christmas. Thank you.
Thank you very much, State Secretary Fiesta, and a Merry Christmas to you too. In this first section, we will discuss e-health solutions in the Barents region from various perspectives. No state secretary from Norway's Ministry of Health and Care Services, Maria Bjerke, will give an introduction to the discussion. Please, State Secretary, let's kickstart the discussion.
Thank you, Chair. I would like to thank the Ministry of Foreign Affairs and the County of Västerbotten for taking the initiative to arrange this conference as a part of the chairmanships and the steering committee of the Barents Program on New Technologies and Methods for Healthcare in Sparsely Populated Areas for organizing the scientific part of today's program. When health was chosen as a main priority of the Norwegian chairmanship of the Barents Euro-Arctic Council and also the Barents Regional Council, little did we know just how relevant this topic would be for everyone and all parts of society in 2020. One can also say that the Barents Program on New Technology and Methods, approved at the Health Ministers' Conference in Oslo in 2019, could not have been more timely. Digital health is important for Norway and is especially relevant in sparsely populated areas in the high north. With e-learning resources, it is possible to offer distance learning in areas without universities and colleges. With telemedicine, healthcare personnel can share knowledge and collaborate from a distance, thus spreading competences across geographical areas and across the healthcare system. Video-based interpretation services is particularly important in the multilingual North. By means of technology, patients can receive healthcare services at home. Remote monitoring, video consultations, and internet-based treatment programs offers patients equal opportunity for care regardless of their home address. In addition, patients will not have to be away from home and work, and fragile patients can be spared the trouble and risks of traveling. The survey conducted by the steering group has provided useful information on the use of digital tools in the Barents region during the COVID-19 pandemic. Preliminary findings show that the COVID-19 pandemic has led to an increase in the use of digital tools in healthcare all over the Barents region. We need to keep up the momentum. The pandemic has shown that we need not less, but more international collaboration in times of a global public health crisis. It has shown how dependent we are on knowledge and good data and sharing information across countries and regions. The Barents Health Collaboration benefits from the high level of commitment by national and regional health authorities and the dedication of the specialists involved. When the pandemic hit us this spring, the steering group of the program on new technology and methods was already there and ready to find new ways of continuing this collaboration. The work of the steering group, and especially the survey, contributes to the knowledge base necessary for a better understanding of the current status and the resources and knowledge we have at hand in the Barents region. Through the survey, we are able to get concrete information about the development of digital health in the Barents region from the very early stages of the pandemic. Preliminary findings indicate that digital tools to support an effective public health response is relevant during the current COVID-19 outbreak, and we must assume that in the future they will become even more so. I believe that we should keep the momentum that has been created and that the Barents collaboration, both on national and regional level has an important role to play in this. I wish you all a successful conference.
Thank you very much, State Secretary Bjerke. The Joint Working Group on Health and Related Social Issues has been mentioned many times already, and we are very pleased to have with us one of the two chairs of the working group in today's program. It's a pleasure for me to now introduce Deputy Director from the Ministry of Health and Social Affairs of Sweden, Jörgen Gyllenblad, who will speak on behalf of Sweden and Karelia. Please, Jörgen Gyllenblad, over to you.
Thank you very much, Madam. I will make a brief presentation of the Barents Working Group for Health and Social Issues. But first, let me give my compliments to Norway and Västerbotten for organizing this very important conference. Issues related to health and e-health are indeed of highest importance and relevance for our Barents region. Our joint working group are, as just mentioned, currently chaired by the Russian Republic of Karelia and Sweden. In our work, we aim at improving the access to health, care, and social well-being for the people of the Barents region. The work has been going on in the group for almost 20 years and has a distinct position in bringing together representatives for governments, regions, organizations, and experts. Russia, Norway, Finland, and Sweden, together with a total of 13 national regions in the Barents area, are members of the group. More than anything else, the pandemic has underlined the importance of building strong infrastructures for international health collaboration and developing new health technologies. The Joint Working Group for Health and Social Issues provides a unique structure for international regional cooperation conducted in close interaction between the stakeholders at national and regional levels. I think this bottom-up approach of our cooperation makes it strong and give a characteristic feature among other international collaborations. In this respect, I agree totally with the comments from State Secretary Halvorsen. In our framework lineup, we focus on 4 main areas of priority: to improve and increase access to health care in sparsely populated areas, the prevention and control of communicable diseases, and the well-being of children and youth in our region. We also prioritize the work with non-communicable diseases, a non-infectious health condition that cannot be spread from person to person, also known as chronic diseases. The first 3 priorities I mentioned are followed by expert programs, where the participating countries and regions take lead, such as the Barents Program on New Technologies and Methods for Healthcare, the Barents HIV Tuberculosis Program, and the Program for Children and Youth at Risk. This is very important topics in health and social well-being to focus on in our cooperation. Our program on new technologies and e-health are of highest importance and relevance for the challenges we face in the region. And the program coordinator, Dr. Sasha Tsereteli, will later this morning inform you more in detail about this very important program that we run in our working group. E-health makes it easier for people to achieve good and equal health and welfare, and to develop to strengthen their own resources for increased independence and participation in the life of society. The technical solutions are there, and I feel confident that the Barents Health Cooperation and our program on e-health will facilitate the creation of necessary framework, not only to meet the demographic challenges we are facing, but also to be better equipped for new, unknown challenges linked to our public health. Dear colleagues, the joint working group will surely continue its efforts for improved health and social well-being, which also contributes to conditions for development and growth in the Barents region. We believe that our priorities and this program, together with the other programs, will enrich and continued fruitful cooperation in the Barents. Thank you very much.
Thank you very much, Working Group Chair Jörgen Gyllenblad. And on behalf of all of us, let me express gratitude to you and your colleagues in the Working Group for your great efforts in order to strengthen cooperation on health in the Barents region every day. Now I'm pleased to take us back to Västerbotten, where we will be hearing from Niklas Forsing from the Center for Rural Medicine of Västerbotten. Mr. Forsling will speak about e-health entrepreneurship for the future. Please, the floor is yours.
Thank you very much. First of all, thank you very much to Västerbotten County Council and the Norwegian organizers for this event and for having us to speak here. I'm going to speak, as you said, about entrepreneurship, e-health entrepreneurship for the future. So if you start sharing the screen, thank you very much. Yes, e-health entrepreneurship for the future. As I said, my name is Niklas Forsing, work for Center for Rural Medicine in Region Västerbotten. I'm going to shortly speak about our organization, who we are. Can you flip this? Oh, sorry. There we are. Center for Rural Medicine is an R&D unit based in Storuman, which is a very small municipality in the inland of Västerbotten. We have around 15 employees, and we work with research and development in the field of e-health and rural medicine. We're basically a project organization and have a core funding of 4 million Swedish crowns. This work is actually carried out together with Nordic Welfare Center and the Swedish presidency of the Nordic Council of Ministers from 2018, and they run a program. So much of this information has been developed jointly with our colleagues in that project. What we have done, so you understand what type of entrepreneurship that can actually be in the future that you should look for, is that we have looked into all the existing distance planning solutions, and this is then only in the Nordic countries. But we have mapped out around 200-300 different distance planning solutions within e-health as well as in social care. And we have made a publication, and that publication you can see on the screen now. And that's downloadable both in English and in Swedish if you want to read it. I've shared these presentation with the organizers, so you will most likely be able to pick this up from the links that I've provided in that one. But what is interesting when you look at these solutions, this is all solutions that are based on well-tested technology. It's not that high-end technology, but it works. So distance planning solutions within e-health distance planning solutions and welfare technology is possible to implement and use within social care and e-health. What we also looked into in this project is, can we actually make these solutions to become a viable service provision offer to the population? And in this case, we have to give gratitude to the Norwegians who have developed what is called in English then the roadmap for service innovation. This is a kind of a guide how to implement distance planning solutions. And this is a very thorough, well-functioning guide, which helps anyone that wants to start thinking of going this way to understand, can we actually start making use of e-health solutions in our service provision? And why I'm saying all this is because it's very important to understand when it comes to entrepreneurship, that the buyers will very much be the social service providers and the healthcare institutions that are in our Barents region. So we have also looked into wearables. We think wearables is having a fantastic future. Wearables are interesting. And in this case, you see like a standard smartwatch that is on the wrist on a person. And And maybe what is most interesting is that the future of integrated healthcare and care may be at your wrist already today. Integrated healthcare and care is deliberately underlined in this sentence here, because we believe that the future of healthcare and social care will be integrated. It will be one service offer to the population. And this is one mean that is helping provide different service options for the population. And what we can see from the 24 practical examples that was published in the earlier publication mentioned from our mapping of all existing distance planning solutions, most of these can actually be found in smartwatches. So if we're looking for entrepreneurship, we will see a lot of this coming even more in future. You have already seen it a lot and more to come. And if you see at this picture, you can see that if you see the top line of this picture, many of the different vital signs that are important for healthcare institutions and social service institutions to keep track of is already available in watches that are out there today. The challenge is, how should we actually be able to integrate this into service provision of social care and healthcare in our Barents region? Well, we can say that it works. We have shown that before. We see it with the 24 practical examples published that it's possible to integrate healthcare distance planning solutions into healthcare and social care. But there are some bottlenecks that we have to be aware of. If you think of healthcare providers, they are responsible for all healthcare data that are being generated. So when they start to generate healthcare data, they need to act upon the healthcare data that they collect in order to make sure that the citizens get the best possible care necessary at every situation. So when we go with the future where more and more healthcare data will be generated from people's own homes or even at your own wrist, this means that the healthcare data will be exploding. And how should we be able to cope with all this healthcare data? So if you look at this picture where you have an individual hub outline and a response service platform mentioned, somewhere here in this field, we see a great innovation potential. This is where maybe the future large-scale companies at the size of Apple and Google will emerge. And I think that the Barents region and the Nordic countries are such an area where this could actually happen. But we need a new type of collaboration. We need to collaborate across social service providers and healthcare providers together with the industry to find the best possible solutions that are possible to use for the citizens at a later stage. In Europe, we have also legislation that is GDPR, and this legislation is often seen as a hinder for any public sector that are working. But GDPR is actually a kind of a human rights act and will, through correctly tailored system, empower the citizens to improve their well-being, because they will be able, through GDPR, have access to the healthcare data. Maybe the future is that the healthcare data will be carried by the citizens themselves to the different healthcare situations that they need to enter. And maybe we could use that healthcare data that are collected by the citizens, held by the citizens, to build different type of support systems through artificial intelligence, machine learning, etc., etc. So definitely GDPR is an opportunity that entrepreneurs should explore in this case, and that we see entrepreneurs are exploring. But again, I can't underline this enough that we need to do this in joint collaboration between social service institutions and healthcare institutions. I took this picture from Nordic Innovation, which is another Nordic institution within the Nordic Council of Ministers collaboration. And they have actually developed a Nordic digital health and medication platform. This will be launched early 2021. And this is a combined platform where you could actually accreditate different type of applications, and you could, through sandbox testing, and you will be able to access different apps through this platform. that are accredited for healthcare services and social care services. So this type of infrastructure will help facilitate further the entrepreneurship within healthcare. And I think we are well positioned, but we need to take the necessary steps to further collaborate with the entrepreneurs to be able to seize this opportunity and maybe have a very large emerging industry coming to the Barents region from this. So that was my short intervention. So thank you very much.
Thank you very much, Mr. Forsling. We will be hearing from entrepreneurs later in today's program. Amongst the Barents members, we have agreed to give priority to promoting the many success stories of our cooperation. There are many of them, and one of them is the very successful cooperation between Tromsø and Naryan-Mar in Nets on telemedicine. We are very happy to be joined by our friends from the Nets Autonomous Okrug, the Department of Digitalization. The Nets is also the next chair of the Barents Regional Council. Please, Mr. Sergei Kongurtsev, we are ready to hear about the success story.
Спасибо большое. Я хочу поприветствовать всех участников конференции, и я расскажу о нашей истории успеха. Да, я представляю Ненецкий автономный округ. Регион достаточно необычный. Большая площадь и относительно небольшое количество населения, сложные климатические условия. До нас сложно добраться, у нас нет дорог, которые соединяли бы нас с другими регионами, нет дорог внутри нашего региона. Все населенные пункты очень отдалены друг от друга. Поэтому мы вынуждены использовать авиацию, что очень дорого для транспортировки пассажиров и грузов. Но, в общем-то, все эти проблемы, они характерны для всех северных регионов. И все это определяет важность внедрения телемедицины, технологии электронного здравоохранения для здравоохранения нашего населения. И важным инструментом внедрения этих электронных технологий является международное сотрудничество. В период с 2012 года мы на практике сотрудничаем с университетской больницей Северной Норвегии. Сотрудничество осуществляется при поддержке Министерства здравоохранения и социального обеспечения Норвегии и Норвежского Баренцева секретариата. В 2012 году состоялся первый ознакомительный визит делегации университетского госпиталя в Нарьян-Мар. Участники делегации ознакомились с ситуацией на месте, мы провели переговоры, и с тех пор мы реализовали уже 3 проекта. Я вкратце расскажу о результатах этих проектов. Сначала мы занялись обучением медицинских работников удаленных населенных пунктов, поставили в больницы удаленных населенных пунктов необходимое оборудование, которое может быть использовано для телемедицины. Это позволило улучшить качество и увеличить количество телемедицинских консультаций. Мы апробировали специальное приложение для наблюдения за больными с сахарным диабетом. Приложение было разработано Национальным центром электронного здравоохранения в городе Тромсе, и для нашего проекта они сделали пилотную версию на русском языке. И, кроме того, мы разработали систему взаимодействия, проведения удаленных консультаций с изолированными полярными станциями. В 2018 году состоялась совместная российско-норвежская экспедиция на гидрометеорологическую станцию «Белый нос». В ходе экспедиции на станцию было доставлено необходимое оборудование, проведено обучение персонала этой станции, как им пользоваться, как действовать в случае экстренных ситуаций. И буквально в прошлом году мы получили первый результат от этого сотрудничества, от проведения этой экспедиции. Один из сотрудников этой полярной станции почувствовал боли в сердце. используя оборудование, которое было предоставлено в рамках проекта и инструкции, полученные в ходе экспедиции, он снял себе кардиограмму и отправил эту электронную кардиограмму для анализа. Она попала в Ненецкую окружную больницу. Врачи сделали вывод, что острой сердечной патологии у сотрудника станции нет, но при этом они дали ему необходимые рекомендации, и в течение нескольких дней у них была возможность контролировать состояние этого человека. То есть на протяжении нескольких дней он продолжал отправлять кардиограммы в окружную больницу. Таким образом, мы считаем, что это очень эффективная форма сотрудничества, взаимовыгодная форма сотрудничества. Мы получаем опыт провинции Финмар-Тромс, которые очень давно работают в области электронного здравоохранения. Они, в свою очередь, имеют возможность тестировать свои новые технологии в наших условиях. Вот такая история успеха. Я считаю, что она действительно успешная, и мы продолжаем сотрудничество. Сейчас у нас есть новый 3-летний проект, который мы начали в этом году. И уже в рамках этого нового проекта мы обеспечили, поскольку сейчас в условиях пандемии, мы пытаемся развивать дистанционные профилактические мероприятия для больных, которые восстанавливаются после инсультов, например, после пересадки суставов, ну и при прочих заболеваниях. Спасибо за внимание.
Thank you very much, Sergei Kungurtsev. It's very interesting to hear for real how cooperation on e-health works and that it really helps people's lives. We will continue with a political view. County Council Leader of Troms and Finnmark, Bjørn Inge Mo, will give a presentation on e-health diplomacy. Please, County Council Leader Bjørn Inge Mo, the floor is yours.
Thank you. You hear me? I have some problem with my video here, but I can take it without any videos. Dear participants, the polar night is embracing us, and the sun have already some time ago shed its last rays in 2020, marking the end of a very special year for all of us. Who would have thought that questions surrounding health and health services will bring with it regulation and limitation on personal freedom, not since the outbreak of the Second World War. Health being a priority for both the National Norwegian Chairmanship and Västerbotten Regional Chairmanship has proven to be extremely timely. I would also like to thank Murmansk for taking the initiative to launch a dialogue on COVID among regions of the Barents cooperation. The Barents region is the region with by far the most people in an Arctic context. It is also the region with developed societies. The region is, however, still very sparsely populated with large distances. In geographic terms, the Barents region equals the combined area of France, Spain, Germany, Italy, and Netherlands, with approximately 5 million people. With such distances and bearing in mind that many use traditional livelihood, e-health is a crucial contributor to the continued settlement here in the north. The University Hospital of North Norway has cooperated with different Barents regions already for a long time. The cooperation have been very useful as it has allowed for the healing of patients on site and to better and faster evaluate the need for evacuation. A very good example of the usefulness of cross-border cooperation. Together we are stronger, together we are better able to develop our respective societies, as just exemplified by Sergey. Another good example will be that video consultations undoubtedly is very useful in a pandemic context. However, and using telemedicine as an example, such cooperate demands infrastructure. Here we will have many ways to go in ensuring interruptible connections. At the end note, let me thank you, the organizer, for organizing this meeting. I look very much forward to learn how we can move the e-health cooperation forward, ensuring the livelihood in the European part of the Arctic. Thank you.
Thank you very much, Björn Inge Mo. It's true what you said, that e-health really contributes to people's lives and that it helps settlement in northern communities. This really underlines the importance of our topic today. Dear Barents friends, we all agree that the indigenous peoples are the heart and soul of our cooperation. Better healthcare is very important for the Samis, the Vesps, the Nenets, and the Komi people. We are very pleased to have with us today Chair of the Working Group for Indigenous People, Piera Heka Muotka. And Piera will speak about e-health from an Indigenous people's perspective. Please, the floor is yours.
Yes, thank you. I'm going to talk a little bit about the indigenous e-health aspects, and I have to stress that I'm not a healthcare expert, but we do regularly work with health-related issues, and indigenous peoples worldwide are particularly vulnerable regarding their health and well-being, and this is also the case for the Barents region. Indigenous aspects of health are complex and manifested, and different issues are facing the different indigenous populations of the Barents region, the Sami, the Nenets, and the Vepsen peoples. I have to stress that one issue is that we do not know enough about these aspects, and that there is a desperate need for more knowledge on indigenous health issues. Indigenous peoples face discrimination and racism in encounters with the public, including healthcare services. There are good reasons to believe that the attempted assimilation policies have caused disparities in health services. Center for Sami Health Studies by UiT, the Arctic University of Norway, conducted a study on the health of the Sami population in certain northern Norwegian municipalities some years ago. And the studies show that in areas where Samis were in majority, their health was on average better than the health of Norwegian population nationwide. In regions where Samis were in minority, generally regions where the assimilation processes were harsher, their average health was worse than the national average, and even worse than the Norwegians living in the same community. The study also found a link between risk for increased somatic symptoms among marginalized patients compared to non-marginalized patients, but only in the areas where the Samis were in minority. In the Sami majority areas, the difference in somatic symptoms between marginalized and non-marginalized patients did not carry statistical significance. I have to again stress that you should read the study if these results intrigue you, as I'm not a healthcare expert or a scientist and might unknowingly misrepresent the results of the research. Because what do you do when, as a Nenets or Sami reindeer herder, are faced with a medical emergency while working out on the tundra, herding the reindeers? If you are lucky, you might have phone reception. Access to the internet and ensuring connectivity in the whole Barents is therefore vital, even on the remote tundras. These are vast areas actively used by humans and not desolate wilderness, and not only indigenous people use them. Do healthcare workers have a sufficient cultural and lingual comprehensions when meeting an elderly Sami patient who has Norwegian as their third language? In the Sami culture, there's a strong cultural drive to not burden others with your problems, even if it means understating the level of pain you are experiencing. A big focus of Sami-oriented healthcare has been to provide enough translators, enabling healthcare professionals to understand the patient. We are luckily seeing an increased use of translators digitally when translators are not available locally. Not being aware of the lingual and cultural barriers might lead to misunderstanding between the healthcare professional and the patient, and then again to mistreatment and misdiagnosis. An example of good practice regarding indigenous e-health is SANKS, the Sami National Center of Competence for Mental Health Protection and Substance Use. The SANKS treatment facility is based in Karasjokka in northern Norway, in what is the former county of Finnmark, but services the whole Sami area of Norway, and also cooperate across border to Sweden and Finland. During the COVID pandemic and travel restrictions, SANKS has been able to carry on treatment online via digital platforms, where many others had to reduce their services. Public healthcare systems lacks knowledge about indigenous languages and culture, and thus it too often fails to provide language and culturally appropriate healthcare service and information material. We often focus on what healthcare services can provide rural and indigenous communities through telemedicine and e-health. But when using these services, we need to remember to also build a general indigenous language and cultural competence among these digital healthcare practitioners. Lastly, I want to reiterate the need for more knowledge on indigenous health. Indigenous specific health information might be challenging to keep records of due to restrictions in some countries on keeping records of ethnicity. In these cases, it's important to revise legislation in order to be able to include the indigenous specific information in national health registers to support research and potentially improve culturally appropriate treatment. Thank you.
Thank you very much, Working Group Chair Muotka. You raised some very important points, and we will make sure to distribute information about the study that you mentioned from UiT, the Arctic University of Norway. On today's speaking list, we are happy to have with us ambitious politicians and strong experts, but we also depend on bright, innovative ideas to have the best e-health solutions from the future. And we are very lucky to have with us young, smart Barents entrepreneurs on today's program. First up is Dr. Maria Arlene Larsen from Lifeness in Tromsø. Please, Dr. Arlene Larsen, the floor is yours.
Thank you so much, Gail, and thank you for inviting me today. One second. There you go. Can you guys hear me well? Okay, so Lifeness is a cloud-based follow-up system that is developed for health professionals. And this time it shows 5 times better results than standard treatment for obesity clinics. My name is Maria Arlene Larsen, and the last 15 years I've been working with obesity and lifestyle diseases. Obesity and overweight is a global challenge, and over half of the population is overweight in the world. In Norway, we are actually in the top of the Nordic countries with 58% overweight. And every year we use over 100 billion Norwegian kroners for this health challenge. And the worst, the individuals are suffering. The treatment for obesity is very long. They go through a primary healthcare, specialist healthcare care. And for some patients, this journey can take from 6 to 9 years. The motivation goes up and down, and the results are sadly lacking. Especially here in the Barents region, it's very difficult because of few treatment possibilities and also long way to treatment. The last 15 years, I've been traveling all over the world trying to find a good solution to help this patient group. I've been learning, I've been sharing my knowledge, and I've also been taking a PhD in obesity and building several specialist clinics in obesity care. The challenge is that we don't have enough resources in health clinics to give the right amount of follow-up, even though we know that the right amount of follow-up very often is one of the key factors for success for treatment. And maybe that is why only 10% are successful in long-term weight loss in obesity. That's why we have developed Lifeness. It is an app for the patient on the mobile, and for the health professionals, it is a web app that they can use in their browser. Lifeness is a secure web-based platform, and the health professional get clinical data at a glance, statistics of the treatment, and also a good overview of the patients who need attention right now, so that they can use their resources in a good way, and also help what patients need different help at different times. The health professionals say that it's time efficient, that they can treat more patients and help more people, and also that they get less dropout. And dropout is a big challenge in obesity treatment because patients lose motivation, and then it's difficult to help them in the long run. We have done a pilot study together with UiT, the Arctic University of Norway, that was presented in the biggest obesity conference in September. And this shows that the people who are using Lifeness get 5 times better results than the people who have standard follow-up. It's very promising. It's a small study with only 27 participants, but still very promising, and we are collecting more results. What does the patient say? So the patients are actually liking Lifeness a lot. They say that it makes it easier for them to lose weight, that the treatment gets better overall, and that it helps motivation. They also say it's easy to use. This is one of the patients group that are using Lifeness, and they were going to this mountain, and they did not think that they were going to come to the top of it in Skibotn, but they did. And they are happily using Lifeness when they are home and get contact with their health professional at the same time. The health clinic says that it saves time for the health professionals, that the treatment gets more effective, and that it's surprisingly easy to use Lifeness in their current practice. We started Lifeness 2.5 years ago, and we launched it in June 2020. And since then, we have had a lot of traction. We have a lot of great collaborations, both research-wise and others, and we have also innovation partnership with one of the Nordic biggest healthcare providers, Unicare. I have an amazing co-founder with me, Solvor Øverlien Magi. Solvor has been in leadership and business for over 30 years, and she also has founded one of the Nordic biggest fitness chains, Evo Fitness. We would like to help many people the next years. That is why we started Lifeness. The next 6 years, we would like to help 680,000 individuals. And one of the reasons why we are so ambitious, and also because of our results this far, we actually won the Social Entrepreneur of the Year last week. And that's fantastic because it's a very prestigious prize here in Norway, and we are the first Northern Norwegian entrepreneur to win this in history. The jury was Crown Princess Farm and Innovation Norway and FAD in Social Entrepreneurs, among others. We are looking to get more good collaborations in the Barents region. If you want to hear more about Lifeness or try it, or are curious to maybe do research with us, please contact us. Lifeness is ready for scaling, and we also are ready for coming to other countries because we have built Lifeness for that. Thank you so much.
Thank you very much, Dr. Arlene Larsen, and congratulations again for winning the Social Entrepreneur Prize. It's really important what you said, that you show to others that everything is possible in the north and in the Barents region. And this is one of the things we have learned from this pandemic that we can achieve a lot through digital solutions. So we just have to keep developing them. Our next entrepreneur is from Luleå in Sweden. I'm happy to now introduce Emil Lilja from Curist AB. Please, we look forward to hearing from you.
Yeah, can you hear me? Can you see me? Yeah, thank you so much for that kind introduction and for the invitation to talk to you today. I hope you can see my presentation now. Just nod if you can see it. Yeah. All right. My name is Emil, and I'm sitting right now in the north of Sweden, in Luleå, and I'm the CEO and founder of Curist. And today I will be talking about our innovation, Curist VR. And the background to our innovation is that we were contacted a couple of years ago by some physical therapists down in Stockholm and Danderyd Hospital. And they presented us with a problem that physical therapy as it is today is very time consuming. It takes a lot of time for patients to travel back and forth to the clinics in order to get treatment. It also takes a lot of time for the physical therapists. They have to do administrative work as well as meeting with the patients, which put an average of 10 patients a day per physical therapists in Sweden. There's also low accessibility, especially in the north of Sweden and in the northern countries. Distances can be very far and patients have to travel a long time just to get to a clinic to be able to get healthcare. And there are also a lot of waiting time, both to see specialists and physical therapists. But after you have had your initial meeting and you have a plan together with your healthcare provider, what kind of exercises you are supposed to do in order to improve your situation, most patients find it very hard to carry out these exercises in a home environment. Disorders can be connected with fear of movement. You get an anxiety from performing your exercises, and this is a huge problem, and it leads that a lot of patients actually drop out. For those who actually carry on with their plan, with their program, it's extremely difficult for physical therapists to actually measure the progress. You can always ask the patient, are you feeling better? But it's just subjective. There are no easy to do objective things to actually measure if you're getting better or not. So with this in mind, we created Curist VR. And on the right-hand side of the screen, you can see a couple of screenshots from the platform, from the training program. And what we've done is that we actually give the patients VR headsets. And when they put them on, they enter a virtual world of rehabilitation where all the exercises are easily presented with instructions, and you move and follow different objects in order to do your exercises. And this is then fun and motivating. The patients are experiencing more that they are actually playing a game more than doing physical therapy. It also makes the rehabilitation a lot easier since everything is outlined. It's almost impossible to do it wrongly. If you do it wrong, everything turns red. As long as it's green, you're doing good. This also means that you can rehabilitate anywhere. As long as you're connected to Wi-Fi, you are always connected to your physical therapists who always have access to what exercises have you been doing, are you following your plan, and what are the actual results. And this means that everything is measurable since we're using digital technology, and patients as well as physical therapists always receive direct feedback from every exercise. So this is how it works in real life. The patients are using the VR goggles, which contain our software with the training program. And it doesn't matter where the patients are. They can be at home, they can be at the clinic, they can be in Spain on vacation, it doesn't matter. When they do the exercises, everything gets automatically sent back to the clinic. So the physical therapists have access to all the data. They can see how much are you following your plan, are you doing your exercises, and how is your progression. So without being in physical contact with the patient, they can alternate the program and make sure that everything is tailored to the specific patient's need. And two user cases we have, this are the two most northernmost regions in Sweden, Norrbotten and Västerbotten. And approximately 500,000 people live here, 5% of Sweden's population. So practically nobody lives here. And it's a huge area. It covers 38% of Sweden. And this combined is roughly the size of Estonia, Lithuania, and Latvia combined. So no people, lots of distance, and this is an area that's very scarcely populated, and it's really hard and a long time to travel for some patients to actually get healthcare. So what they have done here using our technology, that rehabilitation from home is prioritized, and especially during the ongoing pandemic, in order to keep both patients and physicians safely. So patients are given VR goggles, which contain all the exercises that they are supposed to do. They go home, they do their rehabilitation, and they get a follow-up from their healthcare provider every 2 weeks or so. In some regions, they have also placed VR headset at strategic locations. And this can be like public buildings, like libraries, where patients can go, borrow the VR goggles, do their rehabilitation, wipe them, and then hand them over to the next patient. So you actually get like a circular economy kind of thinking here. If you have 100 patients, you don't need 100 goggles. You only need goggles for the ones that are living really far away from these locations where you can actually get healthcare. They also have drop-in rehab at various clinics. So instead of going to the hospital to see your physicians, you can go to the hospital, borrow the VR goggles, do your rehabilitation, and you get a follow-up afterwards. And in some cases before Corona, they also had group sessions at the clinic. They took in a couple of patients. They had a group session, 10 people sitting there with VR goggles, 1 physical therapist. Before the ratio was 1-to-1, now the ratio is 10-to-1. So it's a lot more efficient. So if we can look at what this have meant for the healthcare providers efficiently wise, it's that they can now treat more patients, and physical meetings are no longer necessary, meaning that patients don't have to travel, they can meet more of them, and they can streamline their operations. We've also seen that they have increased the quality of rehab, since everything is measurable, all the data is automatically presented to the physical therapist. They can easily make sure if they have recommended the right exercises or if they have to do any alterations to the rehab program. And compliance is also always a huge issue when it comes to physical therapy. And since the patients are using something that feels more like a game, and they also know that the physical therapist always knows if they have done their exercises or not, this have improved the compliance by a lot. And normally they send the patient home with a piece of paper, some exercises they are supposed to do. Now they are in contact with the patient all the time. If we look at the patient, for them, this has meant it's a lot easier to do exercises, and it's a lot easier to rehabilitate from home, and they feel more safe. The technology are showing them if they are doing the exercises the correct way, and they also have the safety of knowing that a physician is always following up, and making alteration is something that is, if it's not going the right way. Accessibility has also increased, since it doesn't matter if you do it in the middle of the night or in the middle of day. The goggles are always available for you to do your exercises, so you don't have to skip work in order to do your rehabilitation, which you normally do. Now you can do it after lunch, before you drop the children at kindergarten or whatever. We've also seen that it shortens the rehab cycle, mainly due to improved compliance, and it's also fun and motivating for the patients and keep them going. We have been operating for about a year, and these are some of the larger healthcare providers that have implemented our technology today. If you'd like to find out more, please visit our website, cures.se. You can see some videos, some patients talking about how it is to be using this kind of technology, and yeah, a lot more information. Thanks a lot.
Thank you very much, Emil, Lilia. I think many of us who have been sitting in home offices for a long time and have stiff necks, we were eager to know more about this solution, and especially when you have the opportunity to virtually visit a sunny beach, that was quite tempting as well.
Yeah.
So thank you, Emil, and keep up the good work. Now we will go to Finland and North Karelia to Joensuu and Karolina Taminen from Mondo Wellness. Please, the floor is now yours.
Okay, hello. Thank you very much for having me speaking here. I hope you can see me. My name is Karolina Taminen. I am representing myself, and I hope I can inspire you with my story. I work as a stress management coach and a yoga teacher, and I am helping stressed and tired women in business to find the energy and joy and happiness back to their lives. And I would like to tell you a little about myself first. I graduated from University of Eastern Finland to become a teacher, and I was working as a home economics, healthcare, and sports teacher. And I was teaching teenagers, and I loved my job, but I realized it was very, very stressful, and I really didn't have any time to recover, and I didn't actually know how to recover from all the stress I had. And I realized there's a lot of stress going on in the world, and especially now because of the pandemic. And I became an entrepreneur in February 2020. And I have been working as a stress management coach and a yoga teacher, and I am studying to become a TRE trainer, which means trauma, tension, and stress releasing exercises. So after becoming a teacher, I have been studying a lot more, and I have been learning a lot of things to how to relieve stress. And what happened was the COVID-19. So I started my own business, but the original plans changed very quickly. So instead of meeting clients face to face, I had to go online. And I really know I'm not alone. There's a lot of yoga, there's a lot of coaching online. So I really have to think what to do and how to stand out to find the clients, and in order to for them to find me. So I started online on social media. This has been the first platform for me. And since then, I created my own Facebook group to find a lot of women who are stressed, and I'm giving them online yoga classes and workshops. And everything I have on social media is for free in order to make them to trust me, and so that they can know more about my method, which I'm going to tell you soon. I have my own email list. I have a stress test online so that you can do the test, you click the answers, and then in order to get your results, you can give me your email address, and I can get and then you will get the results. And I can get the emails from my customers, because I know social media is something that anyone could hack my account, or one day Instagram is free and the next day it could be you would have to pay for it. So I know it's a little risky, and that's why I have an own email list. And I really had to figure out how to help my clients best and really stand out. So I created my own stress away method to help my clients. And it was a little difficult to translate, so I did my best. And you can see the picture. I have 4 things that I'm teaching my clients, and you don't need any equipment. This can all be transferred online. You can do this online. I'm teaching autonomic nervous system, which includes breathing exercises and feeling safe. We all need that when we are trying to recover from the stress. We need to get body awareness and self-control. I have different tools for becoming aware of thoughts and emotions, learning to be present. And also, if we are always in a hurry or we're busy, we have to learn really a new way of living. We have to make more time for recovery and doing more things we enjoy. And in the middle, there is this support from the coach, which is very important and necessary, especially in the beginning, because I know when you're stressful, it's very difficult to make any changes in your life. So I'm doing online coaching. I have stress management coaching for groups and individuals, and it's really easy to purchase. The link to my online shop is available on my social media channels, and I also use Facebook advertising. And the price is usually cheaper for my social media followers because I know they have been there, they have been following me, and they really know how to work with me. They know my style, I know something about them, so it's easier to connect with them first. And right now I only have meetings in Zoom. I like this digital platform. I can use PowerPoints, videos, different tasks and exercises. We use video and we have conversations. I have groups, and then I can divide big groups into smaller groups and they can do the tasks themselves. I have a Google Drive at the moment for homework and the Zoom recordings. And between the meetings, I keep in touch via email or WhatsApp, including also, I have my appointment times so that they can contact me. And it has been easy because these people who come from social media, they know the social media, they know their machines, and they're very used to contacting people via email or WhatsApp. So I think it's easier for them, and they have really liked that they can contact me by their phones. So why did I go online, or why would anyone go online? I think people are more and more familiar working and meeting people online because of the pandemic, and I can meet people wherever I am or wherever they are. Most of my clients I have never met face to face. So my clients are all around Finland, and it's actually cheaper than renting my own studio or office. That was my first plan, but now since I am online, I don't think I will ever go back because I've learned to do things this way, and I think I'm just developing this and trying to get more and more out of the platforms and getting used to different other platforms and ways of doing things. But I really think there are a lot of opportunities online. I know it's a very challenging way as well, but as soon as you get used to it and you work hard, you can achieve the same goals or even bigger and wider goals as you would do in real life. Yes, so that was my story, and I really appreciate you for having me, and thank you very much.
Thank you very much, Karolina Tamminen. I think maybe you will have some more followers from the other Barents countries after your interesting presentation. I think a lot of us really need to relax more. So thank you and good luck in your further activities. The last entrepreneur in today's program is Yevgeny Timoshin from Nenets, the telemedicine cabinet for remote settlements. We look forward to hearing from you. Please.
Добрый день, коллеги. Спасибо за приглашение. Для нас большая честь поучаствовать в таком мероприятии. Да, сегодня расскажу небольшую историю о нашем решении. Коротенько расскажу опыт применения телемедицинских технологий в Ненецком автономном округе. Это не общее, не весь опыт, а частный опыт нашей организации ООО MIT. Так. Да, вот Сергей Кунгурцев, когда выступал, говорил про наш регион. Да, мы гордимся, хоть он у нас и маленький, но гордый. Ненецкий автономный округ готов сегодня выступать в качестве полигона современных внедрения современных технологий. И для этого сегодня созданы все условия. Наш регион небольшой и очень схож по составу и условиям в целом нашей страны. Реализация вот нашего проекта, о котором я сегодня расскажу, в очередной раз доказывает, что мы готовы к реализации больших проектов интересных. Вот наш проект заключался в том, что создать телемедицинский кабинет. Прототип мы там собрали, попробовали, как это будет выглядеть, и представили первый раз в ноябре 2018 года на международной научно-практической конференции «Арктическая телемедицина». Там мы выставили стендовый доклад, провели телемедицинскую консультацию с врачом Сеченовского университета онлайн. Он проконсультировал кардиобольного. Это все вывели на большой экран в зал и показали, в принципе, живую онлайн-телемедицинскую консультацию. Наши участниками проекта у нас были вот как раз это первое МГУ имени Сеченова. Мы, как инициатор проекта и проектная организация MIT Now, Ненецкая окружная больница, компания из Казани, производитель, ну и наш регион наш поддерживал. Вот состав нашего кабинета телемедицинского. Это телекоммуникационное оборудование и различное медицинское оборудование, лабораторное и диагностическое оборудование. В основном это все портативное оборудование, скоммуницированное для работы в один комплекс, в том числе и интегрировано с информационными системами различными, все в зависимости от задач. Также в головной организации или в головном структурном подразделении мы вот предложили использовать телемедицинский диспетчерский пункт в таком составе. Концепция нашего проекта предусматривала создание телемедицинского кабинета для северных территорий России как законченного продукта. То есть у нас трехуровневая система оказания медицинской помощи. Мы, в принципе, для всех уровней его и пробовали, как он будет работать. Наш телемедицинский кабинет позволяет, позволяет пациентам общаться с широким спектром специалистов в режиме реального времени. Но это в режиме врач-врач или врач-фельдшер, врач-комиссия и команда специалистов. Сегодня врач и пациент – это дополнительный сервис, который пока у нас в процессе реализации. Врач или фельдшер может сразу на месте произвести необходимые исследования и обследования, назначить, скорректировать схему лечения, выписать пациенту рецепт, провести дистанционную консультацию с необходимыми специалистами, а также реализовать повторный дистанционный прием. В 2019 году начали тестирование, уже выезжали в села в наши удаленные и совместно с руководителями от Министерства здравоохранения, от наших медицинских организаций в их структурных подразделениях собирали эти телемедицинский кабинет и на месте проводили уже реальные телемедицинские консультации. Дальше, когда провели тестирование, показался проект интересный, было внедрение. И так как многим сегодня врачам, о чем уже Сергей Кунгурцев передо мной упоминал, что необходимо обучение, необходимые навыки, мы предложили провести обучение на базе телевисочной амбулатории. Мы собрали самый полный, максимально полный наш телемедицинский кабинет и пригласили специалистов различных, в том числе от производителей, и провели обучение по группам. Целую неделю у нас учились специалисты медицинские, это фельдшера, медицинские работники, врачи различного уровня и даже администраторы. Дальше у нас началось применение. Вот на сегодняшний день уже ряд телемедицинских консультаций проведен. Я имею в виду внешних, наверное, больше сегодня. Внутри региона они проводятся гораздо чаще. А я имел в виду внешние, это вот с учреждениями федерального значения. Так вот показано, например, на данном слайде, как проводилась консультация с Сеченовским университетом по урологии. Да, это вот больной урологический был. У него здесь, так как у нас всего в регионе здесь один уролог на весь регион, и была определенная сложность, он не клиницист, если так можно говорить, перевели данного пациента на консультацию с врачами, профессорами, вот, врачами-клиницистами Сеченовского университета. Все достаточно успешно, поэтому радуемся только за реализацию нашу. Совсем недавно, вот в этом году, в марте, мы продемонстрировали, уже нас попросили продемонстрировать результат нашего проекта в Совете Федерации, Российской Федерации. И также для Совета Федерации мы собрали, ну не собрали, а вывели на внешнюю трансляцию, телемедицинскую консультацию между окружной больницей из города Нарьян-Мар и Великовосточной больницей. Пациент настоящий, то есть консультация, в принципе, настоящая. И здесь еще в данный момент у нас 3-й уровень подключился к этой операции директор НИИ, который также нашего пациента консультировал. Поэтому настоящую живую медицинскую консультацию с набором исследований и консультаций врачей различного уровня провели и показали. Все прошло успешно. В принципе, сегодня у нас уже наше решение действующее, уже есть внедрение ряд, и не только в нашем регионе, есть интерес от других регионов. Мы, как от лица нашей организации ООО «МИТ», выражаю готовность к реализации совместных различных проектов. Нам это интересно. Мы все время движемся вперед. Надеемся, что и дальше будем развиваться уже в более широком, наверное, поле, в том числе и в режиме Баренцева региона. Спасибо.
Thank you very much, Yevgeny Timoshin. It's very interesting to hear real life stories on the e-health cooperation. It makes it a little bit more understandable for all of us. And we wish you the best of luck in your future activities. In a little more than a year, it will be Nanette on the regional level who's chair of the regional council, together with Finland as national chair. So we look forward to hearing more from Nanette after that. Dear Barents friend, we are reaching the end of session 1. We will now hear concluding remarks. It's a pleasure for me to introduce CAO of the Regional Health Authority of Northern Norway, Cecilia Dae. Please.
Thank you. And organizers, ladies and gentlemen, and their conference participants. In the Barents Health Program for 2020 to 2023, one of the overall objectives is to improve health and increased access to healthcare in sparsely populated areas. As part of the effort to attain this objective, the Joint Working Group on Health and Related Social Issues has established the Barents Program on New Technology and Methods in Healthcare in Sparsely Populated Areas. On behalf of Norway and the steering group for this new program, I welcome the initiative, and all parties in the Barents cooperation, including NetNets, are now represented in the steering group. The program focuses primarily on mutual learning and development in all sub-regions. Efforts to implement new technology to improve and promote equal access to health services in sparsely populated areas far from hospitals now have high priority in northwestern Russia, northern Sweden, northern Finland, and here in northern Norway. As this conference will show, these efforts have strong support both politically and in health service management within these regions. There are a lot of interesting initiatives and important development projects underway. The steering group is currently working on identifying existing e-health knowledge and initiatives. Specific examples will be presented later today. Through the well-established sound health cooperation in the Barents region, we have seen that despite differences in language, culture, and how services are organized, we encounter many of the same challenges in health service development, both in preventive and health promoting work, in the development and operation of health services, and in health preparedness. Recruitment and maintaining of health personnel is one such challenge. Another is organization and quality in decentralized specialist health services to ensure safe and equal access to such services. Information and communication technology opens up entirely new possibilities in both these areas. And within the current coronavirus pandemic, the development and use of cloud-based services have skyrocketed. In the Northern Norway Regional Health Authority, we recognize that during this pandemic, the use of video-based services has primarily increased for patients with mental health disorders and addiction. But we know that these services have considerable potential in traditional somatic health services as well. This is true for home-based services, but also for the interaction between centralized expertise and local primary health services. And we must take advantage of existing expertise and the potential for development, which may yield models and solutions tailored to the unique conditions that apply in the Barents region. In all parts of the Barents region, there are indigenous people with different languages and cultures, something that requires us to work together across national borders. In Norway, the Northern Norway Regional Health Authority has a national responsibility for planning and developing services for the Sami population. And we are honored to accept this important assignment, and we hope to promote close collaboration with all northern regions without letting regional or national borders impede progress. Our strategy in the Northern Norway Regional Health Authority is to centralize what we must and decentralize what we can in order to meet current and future health service needs. Interaction through digital services will play an important role in providing a seamless and effective health service experience for patients, but also in making sure we meet staffing and competence needs in the years to come. Today, we have good relationships and interactions between health personnel and hospitals in the Barents region, and the new program will be able to build on this. The coronavirus has made us have to switch gears somewhat in this area because meetings in person are not possible right now, but this will hopefully change into not too long. I think many of us are looking forward to being able to meet in person across the national borders. We all share a responsibility for following up on this new program, which I hope will bring us all forward and benefit everyone who lives in sparsely populated areas up here in the north. Let this conference become a joint starting point for a new and exciting time where we can learn from each other and contribute to the success of this program. We expect that from ourselves, and thank you and good luck to us all. Thank you.
Thank you very much, Cecilia Dale. I think you are right that we have really learned a lot, and we have great opportunities to keep learning and push each other in new directions to have the best possible health solutions for the Barents region. I would like to thank all the speakers in session 1. It has been really inspiring, and I think we all feel motivated and optimistic about the future health cooperation in the Barents region. It has been a pleasure for me to chair session 1. We will now take a short break until 11:30 Oslo time before we will resume the program. And session 2 will be chaired by Zaza Sereteli from the Barents Program of New Methods and Health Technology in sparsely populated areas. Thank you from me.